Yesterday was World Tuberculosis Day. It provides the opportunity for affected people and communities to raise awareness around the importance of treatment of this illness. According to stats, South Africa has the 5th highest incidence of TB in the world out of the estimated 322,000 cases in 2017. It's estimated that around 60% of TB patients are also HIV positive. Joining us this morning is National Health Department TB Program Director, Dr. Lindiwe Mvusi. Doc, good morning. And thanks for your time this morning. So, the theme this year, and I mean, yes, we've spoken extensively about what's happening in South Africa, why we are in the position we are in. So the theme, World TB Day, it's time. Are we putting our stamp on that in South Africa? What are we doing here, knowing that we have the devastating figures that we do when it comes to infections?
Well, we've adopted the theme that it's time to end TB specifically. And we know the global targets for 2030, which we've also adopted, of decreasing the deaths related to TB by 90% and the incidence of TB by 80%. And the other target, though, that we've also adopted is that we need to reduce the catastrophic costs that are incurred by TB patients and their families, because we know that TB is also driven heavily by poverty, and people then find themselves in that cycle of poverty as a result of TB disease and need the support to actually get out of that poverty cycle.
So what is it that the rest of the world is doing? Because there is a joint initiative called Find Treat All, #EndTB. What are its goals, and how are we, whether we are falling short, or how are we contributing?
Well, we have realized in the country that much as we are reporting around 227,000 patients a year, and this number has been going down over the past 5 years or so, we realize that based on the estimate in terms of the prevalence or the actual burden of TB in the country, we are still not finding everyone whom we are supposed to find. For example, the World Health Organization estimates that we should be reporting around 345,000 patients, and we have a shortfall of about 160,000. And we therefore have identified or adopted a strategy to find those missing TB patients who are out there in the communities, do not know that they have TB, to actually screen and test them for TB. And as part of that as well, we will be testing everyone who's coming through to our facilities, screening and testing them rather, who's coming to any health facility for TB, so that we don't miss them. Because the tendency is that people know the symptoms, but they think it's normal until they get really sick, and then they go to the hospital for testing.
So you speak of those who don't know, Doc. What about those who do know but don't want to come forward because of the stigma? And we know that it's 2019, but we still have a stigma attached to TB. How well are we doing in bringing about awareness when it comes to the stigma and breaking that down?
When it comes to stigma, that's a really big problem that we're facing, and we haven't really addressed stigma that much, and we still need to understand what interventions can we actually implement to do that. But what we're currently doing is to educate people, have awareness campaigns in communities, do screening campaigns in communities, just to make them aware about the disease and the symptoms, and the need to present early to the clinics or hospitals for testing. And we also encourage family members of people who have been diagnosed with TB to actually screen and make sure that they do not have TB, because they've been exposed to a person who's been coughing in the house, and probably they are infected and therefore need to be tested. And the testing has to happen if at baseline we find that they do not have symptoms of TB and do not have TB, they need to then go for screening every 6 months thereafter for a period of 2 years.
I'd like your response just to a little article on the front page of Cape Times this morning. It says vulnerable TB health workers are forgotten. And here it is the South African Medical Association and HOSPERSA. They want government to take action on to focus on the forgotten heroes who they say are the healthcare workers when it comes to TB. And they're also highlighting high-risk groups such as the healthcare and mine workers, they say, have been forgotten in the fight against TB.
Well, I agree. Health workers are in the forefront and high risk of getting infected with TB and developing TB disease. And we need to therefore strengthen the infection control in our health facilities so that they are protected from getting infected. But then on the other hand, we need to also ensure that we conduct regular medical surveillance where they would be screened and tested for TB on a regular basis. And if they are found to then have TB, they would then be treated. There is a policy that has been developed, and hopefully that will go through to try and address that in particular. For mine workers, a lot has been done in the past years to strengthen the screening for mine workers, especially because of the risk, the high risk in the mining industry, and a lot has been done by the industry to ensure that they are screened and tested and started on treatment.
Okay, thanks very much for that. And that's National Health Department TB Program Director, Dr. Lindiwe Mvusi, just explaining where we are as South Africa. Yesterday was World TB Day, and our numbers are still quite shocking.